you for joining today's webinar, Why the AAOE Data Warehouse is Valuable to You. Before we get started, I have just a couple of housekeeping notes to review. First, participants have audio access only during the webinar, so that means you're able to listen to the presenters, but you can't speak to them or to other attendees. And secondly, if you have any questions or comments, please type them in the chat box in the bottom right side of your screen so panelists can address them throughout the webinar. And now I'll turn it over to our facilitator for today's webinar, Cecilia Sepp.
Great, thank you, Amanda. Hello, everybody, and welcome to the AAOE webinar series, The Data Warehouse. This three-part series will share information on the use, value, and application of the data warehouse and the benefits it provides to AAOE members. And today's topic is why the AAOE data warehouse is valuable to you. AAOE is launching its data warehouse in January 2018, and this project touches many areas related to practice management, value-based payments, and quality outcomes for patients. I'm your host, Cecilia Sepp, and I'm pleased to be here today with several AAOE board members, Jana Four, Jason McCormick, and Sam Sanchi. We're also joined by Vicki Sprague of AAOE, who is the lead on the data warehouse development. So welcome everyone to our series, and thanks for taking some time to talk with us today.
Thank you.
Great. Okay, so before we start the discussion, I'd like everybody to quickly introduce themselves. So we'll start with the board members. If you could tell us where your practice is located, how many staff you have, and how many physicians are part of your practice, that would be great. So let's start with Jason McCormick.
All right. Well, thank you, Cecilia. My name is Jason McCormick. I am the manager of process improvement at Campbell Clinic Orthopaedics in Germantown, Tennessee. We have 51 physicians, and staff is roughly somewhere about 550 at our 5 locations and 2 surgery centers.
Great, thanks, Jason. So Jana, could you please introduce yourself?
Sure, I am Jana Four, and I'm the administrator CEO of a growing practice in Red Bank, New Jersey. Currently, we have 13 providers and 3 physician assistants and 61 staff.
Great, thanks, Jana. And Sam, could you introduce yourself?
Hi, everyone. My name is Sam Sanchi. I'm the administrator for a solo practice in Wisconsin, Sauk City near Madison, Wisconsin. I have a solo 1-doc practice. There is myself, a nurse, and an x-ray tech. So we're definitely a small practice.
Well, thank you. So we have a great representation here of AAOE members and their practice sizes. So let's turn it over to Vicki and let Vicki introduce herself and tell us a little bit about what she does for you at AAOE.
Okay, hi. Again, I'm Vicki Sprague. I'm the Director of Data Solutions with AAOE. So that puts me responsible for managing the annual benchmarking survey, which many of you are already familiar with, and managing the implementation of the data warehouse project that we're excited to tell you about here today.
Great. Thank you so much, Vicki. And Vicki's going to be jumping in throughout the conversation when we're not throwing questions her way. So thanks again, Vicki, for joining us. So let's dig into our conversation today. We only have about an hour, so let's just get right to it. We're going to start with Jason. You're managing a large practice. Where do you see the value in the data warehouse from where you sit at such a large practice?
Well, thank you, Cecilia. My thought on the data warehouse is that the value is really, it comes from all the different aspects of what our practice is going to be involved in. So, there's a lot of different areas of the data warehouse for us to participate in, and I think the value is going to come from being involved in all those aspects. So not only benchmarking, but also being involved in patient satisfaction, being involved in clinical outcomes reporting, and taking advantage of all the different things that we'll be speaking about today. There's going to be a lot of value wrapped up into the one big program.
So it sounds like you're going to get a lot of use out of it.
We definitely are. It's definitely something that I'm excited about, and I think we'll be jumping in as soon as we can.
That's great. So Jana, where's your practice seeing the value? You're not quite as large as Jason, but you're a little bit bigger practice.
Yeah, so for me, value and participation means getting as much out of, as much meaningful data out of the warehouse as I put into it. And many of you who have used registries and other data depositories in the past know that you get a very narrow scope of information despite the effort that you put into it. And this is an opportunity to get a lot more out of it that's useful to us.
That's great. So kind of leveraging all the data across the board is another great thing. So Sam, you're managing a solo physician practice. So where's the value for the smaller practice who may not be using a sophisticated electronic medical records management system?
Well, in our case, we don't even have an EMR, but we are doing patient-reported outcomes and plan to do patient satisfaction surveys. So for us, this is a way for us to get more involved in the future of where this is all heading towards the value versus the volume. And what's going to happen with us is that we don't have an EMR, but we're going to be, at some point here, we're going to have to get one. And I wanted to position our practice to be able to do that. And I think we're going to be able to piggyback on what AAOE is doing. And so there's tremendous value for smaller practices because the work will be done and the cost is going to be very, very minimal to a small practice. So that makes it very attractive.
So continuing in that vein, for your practice, what's the most compelling reason for your practice to get involved?
Well, I mean, all of us are bombarded with salespeople selling EHRs, selling all the manner of registry services, and what this is going to do is it's going to be I like to think of it as a sort of a friendly sort of tie-in to AAOE that's going to provide such value for us, and that it's just going to bring us forward. And that's what my doctor is not retiring. She wants to keep going, but like a lot of practices, there's many more practices now are using electronic records than were, like, say, even 3-4 years ago. We have done the things with registries to avoid penalties last year and this year, but as Jana alluded to, there just isn't a whole lot there. And I just want to bring us forward. And I think that's what's going to be a big reason for smaller practice to join, just the ease of use and then the cost factor as well.
So that's a great reason to do it. Jana, building on what Sam said, what's your most compelling reason?
So, gosh, there are so many great reasons to participate, but I think the biggest reason that the biggest reason for us is that our association actually owns the data. So for me, that means that I have access to a lot more than the narrow scope of information that you traditionally get out of participation in a registry. It's very narrow what they allow you to have. And I can participate at a level that works for our practice, whether it be small or large in any given year, and I can retrieve information and sort it based on metrics that are meaningful to my group and partners, and that is very exciting for us.
So Jason, you're in a large practice with a lot of resources. So what compels you to get involved in the data warehouse at AAOE?
So one of the things, regardless of our practice size, that's the great thing about AAOE is not only do we represent, or not only does the organization represent larger practices, but we represent practices like Sam's and small groups. So when we when this program comes out and when we begin working with the data warehouse, we're thinking about everybody from the practices with very little resources to the practices with lots of resources. And so we want to make sure that everybody has the availability and the ability to participate and to get the maximum benefit from the warehouse. So a smaller practice like Sam's may not have some of the same resources that we have here at Kimball Clinic. We can dedicate more people or more resources to doing things. So the great thing about this is we're going to leverage everybody's ability to to work with the data and give different ways to participate so that we can get a lot of different value. And so, you know, we've been extremely excited about getting involved in it. Strictly, you know, if for no other reason, just thinking about what it means from a regulatory standpoint, and the things that we will be able to do that orthopedics has never really truly been able to do before. So that's really something that we're excited about. I'm excited about, and definitely, you know, making sure that we're doing what we need to do to give that benefit to all the practices involved in AAOE.
Wow, that's a great approach and a great attitude. So, Vicki, this has obviously been designed, as Jason and Jana and Sam have said, for a practice of any size. So did you have any other comments on that about the usefulness, no matter how big your practice is?
Yeah, I think I can just, add to that. I think that, they represented it well. And, it's like if you're not collecting any of this data when we're talking about patient satisfaction, patient-reported outcomes, or quality measures, if you're not ready to do all three, you can start with patient satisfaction. Or maybe you're already collecting patient satisfaction and you really, you need to do patient-reported outcomes, or you haven't had a way to do it yet. This is the mechanism to get started in that. And, maybe you add quality in another year. And maybe you're not even involved in Medicare or Medicaid, and you don't have to do these regulatory reporting. You don't have to report to make use of the data warehouse. You could actually just collect the quality data and use it for benchmarking purposes to compare to other practices. So it's really designed to be flexible, meet you where you are, and have a way to get started. So that's really.
Well, it sounds like a great member benefit, a great member service as well.
Yeah, and to add to what Vicki was saying, I mean, a few years ago, there was like maybe one ortho-specific EHR out there. Now there's several. We're the only one, and I'm sure they're probably also trying to develop this, a warehouse and a registry for orthopedics. So if we can provide this member benefit, to Jason's point, it will be good for all practices, and we'll be able to drive the discussion about what measures we're using. And so, I mean, that's just a tremendous one place to go and get the collective information and wisdom of all of AAOE. So that makes it it's a tremendous opportunity for AAOE.
And as they say, rising tide lifts all boats. So rising data is going to lift all practices. So let's talk a little bit about the application of data, though. I think as a data-driven strategist myself, data is going to drive strategy. So Jana, how do you think the data warehouse is going to inform your business strategy on a daily basis?
Oh gosh, that's a great question, Cecilia. So as we all know, there are multiple strategies deployed in a medical practice that can range from contract negotiations or optimizing revenue cycle management or patient satisfaction all the way to recruitment. And the data warehouse can be an integral part of each of these and much more. Having data and knowing how to make use of it to make us more competitive in our contract negotiations, in our negotiations and getting people to come and work for us, providers to recruiting providers, and looking at how we manage our revenue cycle and where we can make improvements there. It really is from soup to nuts in a practice that this can be really useful.
That's great. So Sam, how can a small practice also use this for business strategy?
Well, right now we are doing the patient-reported outcomes as part of this commercial bundle that we're participating in with the hospital where my surgeon does her cases. What this is going to do is give us the tools to show how good a job that my doctor does, and it will help us to it'll help us in our, we don't really do any marketing. We're a kind of a multi-generational practice, but it's becoming more and more important as we go along. And the payers and the health networks that she participates in are going to start to demand this information. And so we need to position ourselves to be able to do that.
That's great. So Jason, what are your thoughts on the application of data toward your strategy?
Yeah, I think Sam, my thoughts fall in line a lot with what Sam was saying, and that's, as we move towards value-based care and as we move towards patient-reported outcomes and how this is used to make a distinguishment between a high quality provider and a lower quality provider, it's going to be the data that we're going to be able to use to support the difference in between those. So, where we know, and to toot our own horn, where we may feel like we're the best docs, in the area, now we're going to have some data that really can give us some proof of that, and really we can take that to the payers, or we can take that to the to the employers, and we can begin to have the conversation of, we are a higher quality provider with better outcomes. We've got the data to prove it. So, we want you to contract directly with us, or whatever it may be. So it's going to change a lot of things as we move forward on this value-based payment system going forward.
So the data will support that and the marketing, which is great. So we've had a question from one of our participants, and this I'm going to throw to Vicki. Is the data going to be practice specific, or is it going to be de-identified for processing?
Yeah, well, it'll be reported by the practice and uploaded in various ways that we'll discuss into the data warehouse. Any reports that you see, you'll have access, much in the way that benchmarking survey looks now. You'll be able to see your practice's data. You as a member of that practice, see your practice's data compared to an aggregated set of data and other reports. So you won't be able to identify any of the other practices that are participating. It'll all be de-identified at that level, at the industry average level, but you'll be able to directly compare your practice's data to those industry averages in much the same way that we compare our benchmarking, our productivity numbers, compensation, and so on. So we are working really, that's obviously priority number one, is protecting all of the data that comes into the data warehouse, creating an environment that is secure and will be password protected, and so that only you as a member of your practice can see that data.
So you'll see your own practice specific, but everybody else will be blind.
Right, yes, it'll be aggregated, and there'll be same standards, and that's, what, when we're talking about participation, in this data warehouse, the more practices, the more providers that we have, the better our results are, those industry averages. We need a minimum number of practices and providers to be represented before we can have those aggregated reports. If there's too few involved, we can't display those aggregated results because that would threaten people's confidentiality and the confidentiality of the practices.
And that's so important, of course. So that's a great segue into our next question for you, Vicki, which is, why is the collection and analysis of the data across such a broad spectrum so important?
Yeah, I think there's two sides to that in terms of the type of data that we're collecting. We've focused for years, lots of benchmarking surveys out there, and they focus on the things I listed, productivity, compensation, overhead, revenue, expenses, staffing. We really need to move from the focus on that side of the practice into satisfaction and quality and outcomes, so we can really drive value-based care. So having that breadth of data is going to be huge for all the strategic decisions that we've talked about already, and all this, then the growth of practice and healthcare as it is. And then, the other side of that is diversity among the practices and the providers that are involved in this. So the more involvement we get, the more able we're to look by region for some of these indicators, by specialty of physicians. How does the quality of care vary based on, what the orthopedic specialty is? So, provider type, we're opening this up to physicians and other providers. So what do the physician results look like compared to other providers in the practice? So really, the more involvement, the more robust the findings are going to be, and the ability to find comparison groups that make the most sense for your practice.
So that's great. So there's going to be a lot to look at, a lot of comparison. I'm going to throw Vicki one more question, and then I'm going to ask all the other panelists to respond to this as well from the practice perspective. So, Vicki, the data warehouse is going to support practices in providing information to CMS for quality programs, and it could also support sending information to insurers and other payers. So how is this going to help, like, let's say with MIPS and MACRA filings, for example, and then eventually value-based payments?
Sure. So, either, like we've said, there's multiple reasons to participate in the data warehouse. And if you're going to share the data to the data warehouse for benchmarking so that you can compare to other practices, that's step number one. But then, the same mechanism, we capture the data and we do the aggregation needed for your practice to then report to CMS. You're meeting that regulatory reporting requirement via a registry using the same data that you're sharing for these other purposes. So it really maximizes the use of the data. And then we will, absolutely build in other mechanisms. If we want to use the data report out, if you give us permission to do so, we could share that data for your industry insurance negotiations and other things. That's absolutely important. So we have applied to become a registry for 2018, and pending approval of that, we'd really be able to support that.
That's excellent. So, Sam, how do you see the data warehouse helping your practice specifically with CMS?
Well, I think initially it would just be, since we don't have an EMR and we're probably not going to be able to, without one next year, participate in the merit-based system. We will be able to report our patient-reported outcomes and build on that. So I think it's in our case, it's going to be more of a future thing, and it's going to demonstrate to well, definitely to my doctor the benefit of participating. And I think as AAOE develops this, more physicians are going to say, well, rather than just take our lumps in terms of penalties, why don't we get the data in there, and because we're going to build something through AAOE, a known and, like I said earlier, friendly provider, that will get more buy-in from solo practices that may or may not have an EMR or an appetite to do this kind of reporting. So I think it's initially it's going to be a kind of a mindset change, and then as we go forward, it will become more and more of a benefit.
Okay, great. Jana, so what are your thoughts along those lines?
So I've been participating in quality and meaningful use initiatives since about 2009, and I can say it has not always been easy. Some years are easier than other years, and having a registry dedicated to orthopedic practices will definitely make the job less complicated, especially in the ability to isolate measures that are most relevant to our practices instead of having to comb through the new measures every year and see what's relevant to our practice. It's complicated and time consuming, and having the data warehouse doing that for us at this stage is really a leg up in the process of MIPS and MACRA.
So Jason, what's your view on that? What's your take on reporting using the data warehouse?
Well, I mean, anybody that knows me knows my involvement with meaningful use and all the different regulatory programs over the years. A lot of those programs, and this is one of the things during all the different presentations that I've given and said about meaningful use, and this was never a program. These programs were not developed for the orthopedic surgeons. They were not developed for us. They were not for those doctors to take advantage of and get all of the the things that they could from being involved in those programs. And so what it did was it drove down a lot of participation for a lot of individual groups. Didn't participate as much. But I think what we've done well here, because over the years with meaningful use, we ended up, most providers had to take a lot of exclusions. So we were excluded from certain requirements or excluded from certain things. We're not going to have to do that now. The great thing about the benchmarking and about the data warehouse is that we're going to finally have an orthopedic specific registry or a Qcdr, or we're going to have a place that we can do patient reported outcomes, or we're going to have a place that we can do patient satisfaction. So we're not going to have to sit out. So the more people that get involved and the more opportunities that we have to get involved. It's not just, as you'll see over the next couple of presentations that we do about the data warehouse, there's a lot of different places to be involved. I think everybody here has mentioned that. So it's not necessarily that you have to get involved and now you're reporting directly to a registry and you're completely involved in this regulatory program. You can do just pieces of it over the course of the next year to really get your footing from a quality standpoint and begin to build your own quality program regardless of the size of your practice. This is going to be a tool for us to use to really build your program at your practice, regardless of size.
So if I'm an AAOE member and I'm looking at this and you're saying you want me to participate in this data warehouse, you want me to share more data, well, I'm already doing the benchmarking survey every year or so. Vicki, how is the benchmarking survey going to be informing the data warehouse?
Yeah, so, really the vision is that, it's all the same process, and I want to emphasize that, as in the past, it's not we're not charging you to participate in the benchmarking survey. That's really, we encourage you to participate in the benchmarking survey, collect that data, and then you'll get free access to the benchmarking results. But combining that benchmarking data into the context of the data warehouse allows us to compare across all these metrics. So when you're looking at quality and maybe we start to identify best performing practices, this is really high quality care, really good successful outcomes in a certain area. Let's go look at the other side and what's their productivity at the same time of that, what are the revenue and expenses, and you get a more complete picture. So that really provides a lot of power and a lot of value in terms of looking at both sides of the equation and not just isolating it. So really integrating those two data sets together is going to be really, when we talk about big data and valuable data and things like that, that's going to be very powerful for orthopedic practices.
So the benchmarking survey is eventually going to be rolled into the data warehouse, so it's one stop.
Sure, so, yeah, we have an AAOE data portal, which will be that access point no matter where you participate. If you participate in benchmarking survey and patient satisfaction, it's the same portal that you're going to log into to access the data, so you'll be able to see all of that information in the same location.
So in the same place. Okay, that's wonderful. I mean, if I remember, I'd be excited about it. It sounds great. So also, kind of a researcher, so I love data myself. So we've touched on a couple of times the concept of the Quality Clinical Data Registry, the Qcdr, which is going to be an acronym I think everybody's going to be getting really familiar with. So Vicki, if you could quickly give us a definition of a Qcdr, then we're going to throw it to Jason and see what's the importance of having a Qcdr.
So the Qcdr is like you said, a clinical data registry. It's something that we have applied to get approval from CMS, and once we, assuming we get approval for that, we should know that in the next couple of months. We would be able to then report quality data on behalf of practices that sign up for that service. So they are able to do the registry reporting, and so we've been, the self-nomination for that included, data validation plan, what's our benchmarking methodology, and making sure that we have the technical capacity to take data from practices, do the reporting analysis that's required to that, and then do the submission to CMS. So really they have vetted those Qcdrs out as an approved provider. So that's the long definition of a Qcdr.
Okay, that's great though, thank you, because I think a lot of people have a concept of that, but maybe they don't have that background, so that's great. Thank you for all that. And so Jason, we're going to start with you. You're known as a quality guy, and you've talked a lot about meaningful use. So, and then we'll ask Anna and Sam to chime in too. So let's talk quality here, Jason. Why is this Qcdr so important from the practice perspective? From Vicki's perspective as a researcher and a data developer, we've heard her side of it. What's the practical use? Why should I do this?
Yeah, it's a great place, number one, for all your data to get stored. So your data as a practice, you can look at it at multiple levels. So thinking about it from your individual practice, it's where you're going to dump all of your data regarding, certain types of outcomes or satisfaction surveys or, all this different stuff is going to go in here. And now you can actually begin to pull things back out, and that information can be submitted for, regulatory programs. So, if anybody is familiar with going through some of the MIPS requirements and all of that for over the next couple of years, one of the things you see a lot of different ways to participate, a lot of different ways to earn your points, if you will, for full credit for MIPS. And so you start seeing things like, you get a certain amount of points if you do patient satisfaction surveys. Well, okay, great. So we're going to get some points just for doing those surveys. Well, we can also get points for using a true CMS approved registry. So we're going to get bonus points for that. We're going to get points for maybe, being a part of a registry and reporting that way. There's all these different places that individually are going to allow us to take full advantage of this data registry for our participation in MIPS and all of those different things. And, granted, you don't have to do a whole lot this year and next year to get, maximum, to be neutral and not get a penalty for MIPS. But there's lots of spaces where we're just going to be able to check the box and get lots of additional points simply because we're involved here. So, as we move, constantly I'm saying, as we move towards value-based care and really participating and being involved in things like macro and MIPS and all the different, even the advanced APMs, all of that information eventually, maybe that's something that comes out of the data warehouse, is maybe somehow we're able to say, okay, not only are we getting the data, we know that certain things are improving care, and now we can begin to maybe even take on risk and become part of an advanced APM. There's lots of different places that this can go, but the main thing is going to be just getting involved in whatever level you can and reporting the data. And again, we're doing it to a point where all different levels can be involved. So you don't have to be advanced and have APIs and HL7s and all of that. You can do, just satisfaction surveys with a link through, SurveyMonkey, or, you can upload an Excel spreadsheet, or there's lots of different ways for us to do this. And so that's, the importance is just getting involved. As we get a little bit more comfortable and as we expand on our understanding of the program and everything else, then your involvement can pick up. But right away, get the data in there, begin to reap the benefits of having that available.
You have quality data, you have a qualified clinical data registry, it shows your quality practice, you can build out and have higher quality programs. So Jana, do you have any comments on that?
Well, it's hard to top that, isn't it? So data informs decisions, right? So the best reason really to participate is that even in a minimal level, even just doing a patient satisfaction survey through a SurveyMonkey link into the registry, or collecting pain surveys from your patients, even at a minor level of participation, you are getting meaningful data. And that can begin to inform your decision making in the practice and your ability to benchmark yourself across practices and providers across your region and the nation. And the more members who participate is, as Vicki said, the more robust our data is, and a rising tide, as you said, Cecilia, floats all boats.
That's great. And there's so many different ways to participate at every level. So Sam, what are your thoughts on that topic?
Well, I think it's less obvious for the smaller practices. But we have to think about it in a different way. Think of ourselves as kind of pilot fish, is and what we're doing is we're able to, we have this wonderful opportunity with all these larger practices and AAOE to be building this infrastructure that we would have to pay 2-3 times as much per provider than what this is. And I don't want to steal Vicki's thunder here, but it's just a tremendous opportunity for us to do that. And with small practices, I mean, we're sort of under siege in terms of being gobbled up by larger systems, et cetera. And this is a way, that old saying, if you're not at the table, you're on the menu. And this is a way for us to keep ahead and to get more involved in pushing this value and seeing how we do line up with the bigger practices. Like in Wisconsin, it's dominated by several different large health systems, and I think it's we have a really good story to tell, and AAOE is going to be a great way to do it. And as others have said, the more people that participate and the more data that we can show that's meaningful to CMS and the government, that's going to fuel our advocacy efforts in DC and at the state level. And it's going to make AAOE even a bigger player than it is right now. So it's a value to the association. It's a value to our members, and getting that story out to our physicians is going to be really instrumental in making this work. So I'm very excited about it.
That's great. It is a very exciting project, and as you just mentioned, Sam, advocacy is going to be another long-term benefit for everybody. So we've talked a lot about the importance of participating, the ease of participating, no matter how big your organization is, and how everything will eventually be talking to each other, and the benchmarking survey will be brought in. So we're talking a lot about the individual practices and how it's going to help members, which is great. But AAOE is an organization as well that represents everybody, and you're all leaders of the organization. So how's the data warehouse going to be important to AAOE in the long run and its long-term success? So Jana, let's start with you on that one.
So I think it clearly puts us in a position to lead and not follow. And it uniquely positions us to have access to data and practices and benchmarking and potentially a connection with CMS and a seat at the table for advocacy. But it really, nobody else has a warehouse right now at this level, an organization dedicated to a singular branch of practice or semi-singular. And the unique opportunity that having a warehouse with this kind of data provides us, I think, is amazing. It really does put us in the front of what is going on in terms of data collection and being able to be informed by our own results and our own benchmarking to really lead in the future.
So Jason, what are your thoughts on how this helps?
No, I think, I agree with everything that everybody else has said. One of the things that I think I'm hoping that we see from this in the future is that, AAOE represents a lot of practices and a lot of doctors, but there's a lot of orthopedics out there that are not part of it. And so one of the things that I think is important for us and important for the future of the organization and the data warehouse is going to help us is that hopefully we're going to get a lot of value out of this, and we're going to be able to show the benchmarking, and we're going to be able to show that this is something that other orthopedic groups need to be involved in. And hoping to bring some of those groups and some of those executives that are not current members, getting them to the table and making the data even more robust when we begin bringing all these other groups in as well. So I think, for any organization, membership is the lifeblood. And so for, that is a perfect example of how we hope to offer such a great value that it's gonna be a no-brainer that you want to be a member of AAOE and participating in this because there's a huge amount of value in it all the way around.
And it's the only place to get it.
Yeah.
Another great selling point. So you've all touched on value. Value is subjective. It's defined by the user. It's not like ROI. ROI is objective because I can measure that, but value is what's important to me or what's useful to me. So I'm one of these practices. I'm not a member. I don't belong to AAOE. The data warehouse has launched. What's your most compelling reason? We'll start with Sam. What would you say to me to get me to commit to the data warehouse?
I would say that it's no one else is doing it, for one thing, and that we're creating a platform that's going to be very easy to use, and it's going to be very economical. So as you know, as everyone else has said, why wouldn't you be a part of it? And to the earlier question about what does it mean to AAOE, I mean, it's a revolutionary step for our association to be undertaking. I mean, basically, we're going to have a product that's very marketable and will propel membership, as Jason said, and as Jana talked about, advocacy. So I mean, I think it's a no-brainer, as people have said.
Okay, so Jana, how would you convince me?
Yeah,
What's your argument?
This is such an easy question. This is, and I've used registries for years, so this is the least expensive solution to not just to test quality measures for MIPS and MACRA for governmental use, but for the use of data that you can actually employ in your day-to-day operations in your business.
Hey, Jason, sell me. What's your marketing pitch?
I mean, I'm gonna ask you what you're currently spending on patient satisfaction. I'm gonna ask you that, and you know, the number you're gonna give me is gonna be much higher than we're gonna be able to do with this data warehouse. You know, you're looking at a significant. You know, we've run some of the numbers in the beginning, and we're talking about a significant savings on simply doing patient satisfaction surveys. So, you know, that right there, you know, I can't think of an orthopedic administrator or an orthopedic surgeon that is not going to want to save some money. So if I want to sell you, I'm going to say we're going to give you some of your money back.
Hey, and who doesn't want that? Who doesn't want some more money in their pocket? That's great. So it's time to wind down our webinar. So before I throw the last question to Vicki, I'd like to ask any of our panelists, do you have any other comments or statements or messages you'd like to share with our audience about the data warehouse?
I just say get involved.
I'm sorry, Sam?
Get involved.
Get involved. Very good. Jana, any final comments?
Yeah. I think that data is daunting for a lot of people in smaller practices like Sam's. I think that this cannot be highlighted enough. This is an easy solution to participation in all things data, and where it's been a burden for smaller practices for time and attention and the money and the consuming responsibility that it is to participate at a high level in things, all things data, this I think is going to be the answer. And people can participate at a low level or a high level, and I think it'll bring everybody to the table to participate. I think it can, because it'll be that easy.
Great. And Jason, your closing thought?
You know, I've always said that I believe that, you know, one of the biggest values that we get out of AAOE or out of membership in that is the collective knowledge of the group. You know, we are a very knowledgeable group as a whole, and we support each other in what we do. I think this is another opportunity to, you know, to be able to jump on board with the people that have the more resources. You know, I mean, let's be honest, there's nothing wrong with piggybacking sometimes. And I think this is an opportunity for, you know, your practice, for those, you know, those smaller practices or even those greater practices. Jump on board with those of us that, you know, really want to be involved in this and get involved and submit our data and pull things out and get it going. You know, there's going to be a lot of opportunity here, and I think it's you know, as you will hear over the next couple of days, talking about different measures and different technical aspects and all the different things that we're going to talk about through this webinar series. There's a lot, and it's going to be fascinating, and it's going to be a great product, and I think everybody should just jump on board.
So AAO leadership says thumbs up to the
just
data
one more
warehouse.
thing.
Yes,
One more thing. I mean, in terms of the value of this intellectual property that we're going to create as a part of the data warehouse, I mean, I've often wondered, you know, if only AAOE knew what AAOE knows. And this is a perfect way of getting all that information.
I like that.
And it's just a phenomenal opportunity.
That's great. So get involved, because data is daunting, and everyone working together can find solutions to managing data, having quality outcomes, filing reports. So Vicki, our last question will go to you before we wrap up. How can AAOE members get involved in the data warehouse? Where do they sign up?
Yeah, so I encourage you to visit the AAOE website. I am showing it on the screen right now. If you go to AAOE and log in under resources, there's a link to the AAOE data warehouse. You can get more information. Some of this is shared with you already, and there is a link to a sign up now, where you can complete a contact form that really says, I intend to participate in the data warehouse, and following receipt of that form we'll send you more information on how to sign up in terms of participation agreements and you know, how to pay. You know, it's a very low price per provider for this initial year, so now's the time to get involved, now's the time to get started, and we will work and be ready for January 2018 when we'll start really collecting that data.
That's great. So, and if I've already signed up for the benchmarking survey, am I signed up for the warehouse, or do I need to do another form?
You need to do another form. Yeah, we need to know that you're interested in participating in the data warehouse separately from the benchmarking survey. So we appreciate that contact form from you. And if you have any questions, obviously reach out to AAOE, myself, and we will answer any questions.
That's great. Thank you for that clarification. So the AAOE data warehouse, big data, big issues, but big value in the long run. I want to thank all of our panelists for joining us today. Jana Four, Jason McCormick, Sam Sanchi, who are your leaders of your board of directors. And I also want to thank Vicki Sprague, who is the staff lead on data development and research. So join us tomorrow for the next data warehouse webinar, technical details about the data warehouse. We're going to tell you some background of how it's being built, how the data is being brought in, and how you can use it effectively. So that will be tomorrow, November 8th, 11:30 a.m. Eastern Time. We'll be here at the same link. So I'm Cecilia Supp. Thank you for joining us. And I think we're out.